What is going on, y'all? Travis here, back with another Grey's Anatomy Season 5, Episode 18. Let's jump into it.
Surgeons aren't known for being warm and cuddly. They're arrogant, impatient, mean as often as not.
You can go with straight up chemo and immunotherapy. There's been a lot of success with metastasectomies. We could probably just, cut this thing out.
You'd think they wouldn't have friends. Who could stand them?
You hiding? What is that, a cool surgery?
No.
Well, whatever it is, they're gonna pick me.
Are you sure you just want to tell him?
Yes, I'm sure.
Look, I
Tell
researched a ton of information
him.
here. You should read all of this
So he
before you
could
see
be
the
there for
oncologist.
you.
I called Dr. Golding, and he gave me a direct referral to Swinder.
What are you doing here? I told you I was fine.
Oh, God, you're so not fine.
What, you still haven't heard from him? No word?
Izzy, don't you think you should call in sick today?
What? Why?
Because this is a lot of reading, and you're sick.
You guys coming? Big surgery today.
Yeah.
But surgeons are like a bad cold. Nasty, but persistent.
I need to ask you about...
Phone. Have you heard from Derek?
No.
Oh, I'm sorry. You were saying... Oh, Meredith.
No, I don't know how he is. I have heard nothing. And no, I will not go back out there.
You go out there.
Hey, who moved my surgery? Chief.
Just don't. He's a wreck. He's disintegrating before our very eyes. He can't lose Shepard. I mean, I'd go talk some sense into him, but he's got too much on my plate.
Tried calling him?
About 100 times.
No. You want me to go to the woods? No. The woods are dirty and there are many, many bugs.
Many.
What am I going to say to the guy? I barely know him.
You're both surgeons. You've been through the same war.
You're kind of a bully, you know that?
Wouldn't do it if it didn't work so well.
This is one of the biggest surgeries you may ever get anywhere near, so please pay attention.
love
the
her.
patient is a 38-year-old male. He suffered severe facial trauma.
No nose, no lips. That's why we've dubbed him Blowhole.
This surgery has only been done 4 times worldwide, and all of the candidates have to undergo extensive psychological testing.
This surgery has a huge chance of rejection or infection. The patient will have to be
He'll be on
immunosuppressed
lifelong
for the rest of his
anti-rejection drugs, which put him at risk for lymphoma, diabetes, hypertension, renal failure.
I hear they call the dude Blowhole.
What did you just say?
Blowhole.
Nothing.
Don't talk anymore. Ever.
Holy crap. Blowhole is right. Surgeons. Nasty, aggressive, unstoppable.
I'm scared.
Just the kind of people you want on your side when you're really screwed.
Ladies and gentlemen, this is Mr. David Young. Today he'll be receiving a face transplant.
A face
Dr. Hunt's
transplant.
team will be recovering the donor facial graft. We're replacing 70% of Mr. Young's face.
The donor recovery will include his nose, left eye, lips. Why will allotransplantation work better than traditional techniques?
Better aesthetic outcome, which allows for reinnervation of the facial nerves, giving a better functional result.
Then we'll position the flap over Mr. Young's face. How do we know when we're in the clear?
When
a
the graft turns
flap.
pink.
Excellent. Dave, any questions for us?
Has anyone seen the donor? What does he look like?
I think you'll be satisfied.
It's a face, right? If I end up anything above a point and stare freak, I'm gonna call it a success.
You with me on the donor. Usually we take them at the same time. The donor's life support is fading fast. We gotta
I'm
move.
scared.
Thank you, sir.
Stevens, Gray. No, the other Gray.
Really?
You did an awesome job in there. Would you call me after the pre-op labs come in?
Dr. Sloan, only one resident?
There's already going to be enough of the crowd.
What the hell? Izzy, I don't think you have time to scrub in with Sloan.
Don't worry about it. I can handle it.
She gets to work on Blowhole because she gets Sloan.
Shut your mouths!
Finish the chart. I'll be back.
O'Malley, Gray, I need you on pre-ops and post-ops.
There's the biggest surgery in the world happening here today.
Yes, and half our attendings are involved. Yang, you with me today. You're moving to the big leagues.
What?
She gets a solo.
Today?
Nice old lady with a hernia, you're gonna fix it.
Congratulations. I know I should seem more enthusiastic, but I'm not that big a person.
Don't worry about it.
Is it wrong to have hatred in your heart?
I'm Dr. Christina Yang. I'll be performing your hernia repair today. Do you have any questions before we get started?
Oh, yes. Can you hand me my purse, please? My friends gave me a bunch of questions, and they're such worrywarts. They thought not to go when this hernia started becoming a problem, but I told them no. We have been saving up for this for 2 years. It helped that I was able to get my deposit back with the doctor's note.
Christina Yang? Yes? No, it has to be today. It's stage 4. No, she has to see Dr. Swinder, not a partner. I'm sorry, ma'am. I will get to your questions when I come back to examine you, okay? Referral is Golding.
Stage 4.
It's a little early in the day for that, don't you think?
You sound like my mother.
I met your mother. I liked her.
Who sent you, Richard?
Bailey.
Of course.
Look, I'm sorry about your patient. I know how hard it can be. I had a patient a couple years ago. Young guy, 50 maybe. Simple knee replacement. He was fine. I even told his wife she could go and get him lunch. But he'd been getting short of breath, so I put him on blood thinners for a post-surgical PE. It wasn't until he was vomiting up dark red blood, looking me in the eye, telling me that he was dying, that I figured it out. that I was wrong, that it wasn't a PE. He was bleeding internally. And it wouldn't have been fatal, but blood thinners.
Damn.
I will never forget the look on his wife's face when she came back with that sandwich in her hand, asking me why her husband wasn't in his room anymore.
How do you live with it? Killing him, taking him from his wife. How do you live with it?
We call it malpractice.
Yeah, I know what we call it. I'm asking you, when you get up in the morning, how do you look at yourself in the mirror? I'm asking.
She gonna crack open a beer now?
Can I get one of those?
Told ya.
Yeah.
It's the not knowing that does it. Maybe I've just been dumped. Not knowing if I'm single that makes me want to throw up all day long. You are not listening to me, are you?
Sorry.
You've got solo surgery and G.I. Joe. It's a charmed life.
I have not had G.I. Joe.
Still no sex.
Not a charmed life.
Lab results from the splenectomy?
Do we ask?
No, because he might tell us.
Can you imagine? This guy's got a family, right? One day they're gonna be walking down the street and see his face on somebody else's body. It's kind of creepy, right?
The underlying facial structure of any two people can be very different.
Donor's family wouldn't recognize this face on anyone else. All right, I'm making the final dissection. Rev, hold right to the temple and gently lift. Don't tear the flesh.
Oh my god!
Awesome.
I'm gonna have nightmares.
Tenderness surrounding the incision is normal. No signs of infection. Did you redress that wound?
Megan, will you please go to room 2214 and just take out the drain when you're ready?
I know it seems personal, and we wouldn't ask if we didn't need to know, but have you passed gas yet?
Sorry.
We can't release you until that happens.
A love
I'm
triangle?
sorry, I'm trying to listen. Are they supposed to look like that?
Like what?
Bleeding and the shiner, and that one looks like she's suicidal. They're supposed to be doctors?
We're gonna reserve judgment on that for right now.
Freak show.
Can we shove them in a locker? We're professionals, and that's clearly personal. We'll just waste time. We'll never get to see the solo surgery or the face transplant.
We should just ignore it then.
Yeah, we should just ignore it. It's a professional thing to do.
There's a
Risk of rejection and infection. You know you drilled in and know I had 1,000 times.
Someone's gonna need to take care of you afterwards.
My friends are coming after the surgery. I'm excited to meet them. We met in an online chat room for orchid lovers. We've never actually met, so.
After the surgery, this device is going to help prevent lung problems by exercising the muscles you use to breathe.
Sit up straight, take 3 easy breaths, and then blow into that.
Oh. That's it. Both of you in the hall now. You think that was doctorly?
What the hell's going on with you?
They were making completely inappropriate jokes at the expense of the patient. I have been trying to teach them, and they were cruel and inappropriate.
Okay, they were inappropriate. You know what else is inappropriate? You. This case is my baby. I've spent 3 years planning for it, and you and your emotional life are not about to piss all over it. You're off the case.
You can't leave him alone with those interns.
Okay, you can be there before and after the surgery, but you're not coming in my OR, and whatever's going on with you, Stevens, you better get it under control.
You're gonna feel bad. You're gonna feel like shit.
Found them. There are your questions about the surgery?
I can't seem to find my glasses. My friend should be here.
Okay, will you finally be able to pick up your grandkids? Is this a question from a doctor?
No, my other friends helped me with some questions. Plus, I added a few on my own, like, will it hurt?
Oh, you'll be anesthetized.
Well, yes, I know that. I mean, after. Will it hurt?
You should expect normal post-operative pain. Yes?
Christina.
It's fantastic. No, I'll take it. Thank you so much. Thank you. No, I'll get in touch with her right away. 2:30, any time is fine.
Mayor, there is something wrong with Izzy.
What do you mean?
I don't know. All I know that there is something wrong.
You know, George, we're already drowning in intern drama. We don't need resident drama, too. If it's a problem, she'll tell us. Until then, just ignore it. I repeat, ignore it.
What in God's name is going on?
We are just trying to give them their privacy.
Or do you think I wanted to get involved with your little intern drama? Get married in Vegas, shacking up with attendings, cutting LVAD wires. We have to manage it.
Oh, we've got it under control.
I love you, Megan.
Are you okay?
Oh, hell no.
Whatever it is, it stops now. You are scaring the patients, and you're making this hospital look ridiculous. Just stay away from each other, so much as a tear or a glance in each other's direction, and it's over. Don't talk while I'm talking. Just get out. Go. Not together. Oh, that felt good.
Page me, Dr. Bailey.
You finished with your part of the face transplant.
Cleared my schedule to watch Sloan and Dr. Yang do their surgery, so whatever it is you need, I hope it's not too time-consuming.
All depends on how fast you can drive. I need you to drive out to the woods and talk Derek Shepard into coming back here. And I believe you also might run into Callie Torres. See, I sent Torres after Shepard, and she's fallen off the grid. Her phone goes straight to voicemail. I need you to get Torres and Shepard and bring them back here before the chief notices that any of you are gone. You survived a war. You can do this.
I know I can do this. I'm saying I don't want to.
Nobody tells Bailey no.
People don't really say no to you, do they?
Not when I say please. I'm saying please.
Oh, our set transport's on its way. You said you had some friends that were coming to take care of you?
Yeah, after my surgery.
They're coming now.
Surprise!
It's me, Shayna. You could probably tell from my Vonda Rush, Shaliana. I hope you're not mad that we came early.
We thought we should be here through it all. Make sure you knew.
Get out. Get them out. They're strangers. I don't want them in here.
We're hardly strangers, Dave. We chat every night, all night for years. We flew in.
Get out. We've never met. You don't know me. You don't know anything about me. Get out. Get out.
Did you get my page?
sad.
I got the appointment. Oh, how amazing am I? It usually takes weeks to get in there. Did you take a look at the research?
Can I just eat?
No. I'm sorry, you don't have time.
Time for what?
There's an enema.
Izzy's enema.
I was supposed to get an enema today, but I decided it can wait. How about we talk about something else?
You've been complaining about being really backed up, and I got you an appointment.
You really booked her an appointment for an enema?
You can't just say that you're all backed up and just sit there, Izzy.
I think maybe you're the one that's backed up. Solo surgery panic? I'll scrub in with you. If you can't handle it, I'll take over.
Okay, I'm just saying, enemas can be a serious business.
Okay. Is the enemas code for what?
My enema? My business.
15 minutes.
This is a
Go to the appointment.
I was a second-year resident. Parents were in the front seat, 3 kids in the back. Kids were okay. Mom and Dad were a little banged up, but nothing terrible. They were talking and laughing in the ER. Both parents had massive internal injuries. I operated on them both that night. Lost them both. If I'd known how bad off they were sooner, but I didn't. The oldest kid was 9. When I came out to tell him, he was trying to console the 3-year-old and the 5-year-old about their mother. I'll never get that image out of my head. This 9-year-old boy trying to hold these 2 little ones. His arm's just not big enough. I don't know how I came back the next day.
That's sad.
I think part of me never did.
I'm surprised you didn't talk about Iraq.
I don't talk about Iraq. What my point was, I went back. I showed up for work, you know?
You get dead inside. You get dead inside because if you actually felt it, no way you're going back.
Everybody's gonna be there getting litty.
You blew it off? I called every favor I had in this hospital and then some. Why didn't you go?
Why do you care so much?
Why don't you?
We're calling the guy Blowhole, Christina, not just the interns. Alex. What are they gonna call me when I'm the patient? Swiss cheese for brains?
But that's awkward and long. Blowhole's pithy.
I cannot with Christina.
This right here is an emotional thing you're having, which is why you should tell Meredith or George.
I'm not telling anybody.
You're not dumping this on me. You're not dying in my arms. Either you tell them or I will.
I don't even know if I want treatment, Christina. I know how violent surgery can be. Derek Shepard is in the freaking woods right now because we fail all the time. I have a 5% chance of survival. 5%. Why run poison through my veins, irradiate my brain if it's not gonna work anyway?
I would feel the same,
Why
probably.
did you tell me then?
Just keep your mouth shut. Forget I ever told you anything.
Izzy.
That is a lot to have on you.
You need to
Gang,
call back, Dave.
You're my surgeon. You're not my shrink, so why don't you just do your job?
Because I can't do my job anymore. Part of you being the right candidate is having a support system post-op. The ethics board will not allow me to let you do it alone. You need your friends.
You see that orchid? To anyone who doesn't know orchids, it's dark and droopy and it's ugly. Unless you understand how it adapted and how strong it had to be to survive. Photo of that orchid. That's the only picture my friends had seen of me. People look away from me. Kids cry and adults cringe. They look away. I didn't want my friends, I didn't want them to ever have any reason to look away.
They didn't.
I do feel bad,
Your
man.
friends, they didn't cringe, not one of them. You looked away. You didn't trust them. You looked away from them. Like, let us call them. They flew all the way here. Just let us call them back.
If you want this surgery, Dave, you gotta give him a chance.
Chief, how's your mood?
Meager, anxious. I'm excited about Sloan's face transplant. All in all.
Do I look like a therapist?
You asked.
I've lost Hunt and Torres. I sent them to get Shepard, and I never heard from them again. I'm telling you, and my next move is that I'm gonna call the police because I'm half convinced they're all dead. On a spit, with a one-armed man turning them into shish kebab. Sir, it's my mind. It just goes there.
Why are they starting late?
They've only got a few hours left for that face to still be viable.
Son must be freaking out, right?
Home record? What did you just say? What? What did he just say?
You two, get out. You, come with me.
You need to start talking.
I really can't. Talk to Steve.
Right, guy. They're gonna start that face transplant surgery, and
My best friend
is gonna have her very first soul surgery, and so...
Look, it's not my place.
Okay, you are gonna tell me everything that's going on. Or else every time I have a rectal exam or an infected abscess, it's gonna have your name on it.
Megan was with Pierce, but they broke up for a little bit. She slept with Steve. And then she got back together with Pierce. Steve sent her an email about how they slept together. He hit reply all, and now Steve says he loves her. Pierce wants to kill him. Megan's like really freaking out, right? Because a while back, someone sent this text message, right? It just came to certain people's phones.
They were like, I thought this was gonna be good.
Why would they come back? I was cruel. I was hateful.
You were scared. They surprised you. You were in shock, and it wasn't what you were expecting. You were just...
I was awful.
You were scared. And you were trying to protect them. If they're your friends, they'll understand.
I didn't want you to see it. It isn't me. I didn't want you to see it.
This right here looks just like the Coriantha speciosa. You guys see that?
She's right.
The coloring's just the same.
If the surgery doesn't take, I'll leave you even uglier than I am right now.
Don't call my dear friend ugly. You're a survivor, and it's written all over your face.
Oh my god. I think the thing is that it's just like so shocking, so it's like hard if you're not expecting it. Like at the beginning of the episode, I was like, holy shit, and like taken aback and freaked out a little bit, but the more that I'm like seeing him and getting to know him, he's a sweet person and I feel bad, but it's like, it's just the initial like shock,
We've
you
all
know?
had tough losses. We show up the next day and we try and save the next life.
Yeah, we covered that too.
Okay, what about this? Nothing we do can stop death. We can hold it at bay now and then, but everyone dies. And that's not on us.
That's true.
I took a pregnant woman in for a simple surgery, and I botched it. That is on me. I should feel badly about that. You should feel badly that while I was out here, you sent Meredith out here expecting a ring. Why, in God's name, would you do that?
I was trying to help. She didn't want to come. She wanted to leave you out here alone. I was trying to help her.
You were trying to help yourself, not me. I hit the ring in the woods. In the woods. You destroyed me.
And I can't put the face like in
We'll
the
place the facial
vat
now.
of
I'll be
water
connecting the
or
vessels
whatever
now.
that is.
Yes,
Kind of
right
scary.
Okay, people. It's time. You ever put a new face on someone?
Really?
I'll take the right side, you take the left. Very gently. Take your time. He's not going anywhere.
Looks like lunch meat.
Watch the left corner of his mouth. You're off center just a bit. Be careful around the eyes. Very good, Dr. Gray.
Get out. No. Right side! No! Get out! Look, I've destroyed lives before. Several, in fact, and yours is not one of them. I sent the woman who loves you out here to bring you back to your life. You're scared, you're drunk, you threw a punch at your best friend, you threw a ring at Meredith, and now you want to throw me out. I'm not accepting it because I'm older than you, and I've been where you are. You've been drunk for a few days, I was drunk for years. And I know you're going to need at least one friend when you decide to come out of that hole you're digging. I hope you come out of it soon. I'll be here when you do.
I don't think I can get her back.
Did you call her?
God, he looks terrible.
What am I gonna say?
Sorry.
I had an affair for years. And when Adele found out, somehow she took me back.
Cause she crazy.
You can make your way back from anything.
This is year one of your residency. You turn on each other now, yeah, you're not gonna make it.
Here's what's gonna happen. All of you are going to go find the sense that the good Lord gave you and never behave like this ever again. Pierce, get an ice pack and put it on that oozing, disgusting mess of an eye. Go to the pit and get that unsanitary, bloody hand x-rayed. And Megan, you should go to OB because yes, you are pregnant.
That was very Bailey.
You ready, Dr. Yang?
Damn.
Wait, I need one thing from you before I go under. I haven't asked for much. You haven't answered my questions, and I understand that you're busy, but I need you to tell me that it's going to be okay. You're my surgeon, after all.
This isn't a silly procedure to me, Miss Sally, and I will get you through this.
Okay. Thank you. I'm ready
Please
now.
don't let nothing happen to that lady.
Izzy has stage 4 metastatic melanoma that has spread to her brain, liver, and skin. She may only have months to live, and she's resisting treatment. She needs help.
Are you fucking kidding?
Scalpel.
I mean, she had to get it off her mind before she did the surgery.
No, don't try.
I can't
Can you
believe she
see
just
his
did
new
that.
face? I think he'd really like to see it.
It's very swollen and bruised. The tissue needs time to settle. But yeah, I'll give you a sneak peek.
Wow.
Sometimes we fail, but that's not always the case. I know. Blowhole has a new face. You know, and what people call him to get through the day. Christina. Yes, I know. I told Alex and Bailey, and they're telling Meredith and George. Christina, you know, I couldn't do my job. I think you came to me for help, and that's what I did. Because sometimes we win, and I want you to fight, okay? You know, for whatever that's worth, I want you to fight. Thank you.
That means a lot, I think, to her. Oh my God. Oh, she said, fuck y'all. Fuck y'all and your feelings and your opinions.
Dr. Gray.
Y'all can kick rocks. I
They
don't
think
give a
that
fuck.
You're taking advantage of me.
I'ma
They think
kiss
that I'm
my
using you.
mans.
But they don't know us. They
Do
think
it.
that we're ugly, but I know that we're beautiful, and we can adapt to a hostile environment.
Yes.
Thanks for coming.
Thanks for calling.
I love you.
I know.
Would you still love me if I wasn't a surgeon?
No. No, because Izzy has skin cancer that spread to her brain. And you're one of about 20 people in the world who could save her. And I don't know if I could respect somebody who could walk away from a gift like that. So please don't. Here are her scans. It's pretty bad. Practicing medicine doesn't lend itself well to the making of friends. Maybe because life and mortality are in our faces all the time. Maybe because in staring down death every day, we're forced to know that life, every minute, is borrowed time. And each person we let ourselves care about is just one more loss somewhere down the line. For this reason, I know some doctors who just don't bother making friends at all. But the rest of us, we make it our job to move that line, to push each loss as far away as we can.
Bro, that episode was incredible. I love this show. I love that Christina was there for Izzy. I hate cancer. Woo! I really fucking hated that Denny storyline with like the ghost and them banging and stuff. Like, I just thought it was so over the top and stupid, but I get why they did it. I can't. I really don't want to have to watch her like go through that shit, and I know it's going to be heartbreaking, and oh my God. I know that I've like only scratched the surface on this show with what they're probably going to put me through, but I fucking love it. Let me know what y'all thought about this one. I'll see you on the next one. Bye.